Psychology is the modern religion. Lately, it has become impossible not to notice how many people now believe that almost every human problem must be worked through with a psychologist. Relationship conflict? Go to a psychologist. Family tension? Go to a psychologist. Low mood, lack of motivation, confusion about life, dissatisfaction with work, uncertainty about identity, ordinary conflict between two imperfect people. All of it is increasingly framed as something that must pass through the language, rituals, and authority of psychology. Even the way people speak has changed. Everyday speech is overloaded with psychological vocabulary. Trauma, triggers, boundaries, narcissism, attachment, abuse, gaslighting, inner child, burnout. Some of these concepts are real and useful when applied carefully. But what is striking is how often they are now used loosely, mechanically, and without understanding, as if psychological language itself had become a kind of sacred code that gives authority to any statement. And this is where the resemblance to religion begins to look hard to ignore. Many people now approach therapy not simply as a tool, but as a worldview. It becomes the main system through which they interpret themselves, their families, their relationships, their suffering, and even their purpose. Everything gets translated into therapeutic language. The confessional booth has changed form, but not function. Even more striking is what often happens after long immersion in the system. People radically reorganize their lives. Couples separate. Families become estranged. Friendships collapse. Someone returns from a retreat, speaks in a completely new language, begins defending newly discovered personal boundaries, and treats this as a kind of awakening. And strangely, even when relationships are destroyed rather than repaired, many still describe the process as successful. Everyone seems satisfied because each person has supposedly chosen themselves and protected their truth. But if therapy was meant to help a relationship survive, and the relationship still broke apart, then one might reasonably ask whether the process actually solved anything, or simply rebranded collapse as growth. This is not an argument against treatment when it is genuinely necessary. There are conditions where a competent medical specialist is essential. Severe depression, psychosis, suicidal crisis, trauma, panic disorder, debilitating anxiety, addiction, genuine psychiatric illness. These are serious matters, and proper treatment can be life-saving. That is obvious. But outside such necessity, something else seems to be happening. For many people, psychotherapy is no longer just one method among others. It has become their faith, or at least something very close to one. Look at the structure. There are schools, denominations, and doctrinal lineages. Freudian, Jungian, CBT, Gestalt, transactional analysis, psychoanalytic, humanistic, integrative. Each has its own canon, its own preferred language, its own interpretation of suffering, its own sacred founders. There are elders, Freud, Jung, Byrne, Rogers, and many others. Figures quoted almost like church fathers. There is initiation. One enters the system through training, supervision, personal therapy, certification, endless hours of case review, approved methods, internal hierarchies, and association structures. A junior practitioner is guided and judged by a senior one. There are recognized schools and accepted interpretations. There are insiders and outsiders. There is orthodoxy and suspicion toward heresy. There are also fees, and this part is rarely ignored. If old religion once collected a tithe, modern therapeutic systems often collect something far more regular, more individualized, and more expensive. The schedules are full, the rates are high. The authority is soft, polite, educated, but it is authority all the same. The resemblance becomes even more obvious at the level of function. The patient comes, speaks about personal life, confesses wounds, shame, guilt, resentment, fantasies, fears, family problems, sexual problems, anger, confusion. The specialist listens, interprets, names the condition, gives a framework, suggests a path, and gradually becomes a mediator between the person and reality. In older religious systems, a priest once heard the confession and offered moral interpretation. Now the therapist hears the story and offers psychological interpretation. The language changes, the ritual remains, and of course, like any system with authority, psychology can also manipulate. A person in emotional pain is highly suggestible. Someone who arrives confused, lonely, ashamed, or desperate can become deeply dependent on the person who explains them back to themselves. And once dependence appears, the line between healing and influence becomes much less clear. That is why the whole phenomenon deserves more skepticism than it usually receives.